And then another big thing that happens at this point is pumping. And this is another reason why I think it's important to get your pump as soon as you possibly can, even if you don't think you're going to use it. Like, even if
Yeah.
you end up not needing it, it's still just good to go ahead and have on hand just in case. Because I've been in a lot of situations where people, they were like, well, I'm going to exclusively breastfeed, so I didn't buy a pump. And then their baby goes to the NICU and they get discharged before their baby gets discharged, which is also really difficult on you emotionally and the stress of it all.
You're listening to the Mommy Labor Nurse podcast, where you'll gain the knowledge and confidence you need to erase the unknowns of pregnancy and birth and rock the newborn days like a boss. My name is Liesl Teen. I'm a fellow mom, labor and delivery nurse, and your host. Each week on this podcast, you'll hear a mix of birth stories, expert interviews, and other fun pregnancy and birth-related content. As a reminder, anything you hear on this podcast is not medical advice. Please see mommylabornurse.com/disclaimer for more details. And now let's get into this week's episode. This week on the Mommy Labor Nurse podcast, I had the opportunity to interview Erica Campbell, who is a mom of two, registered nurse, and international board-certified lactation consultant. Erica is also the face behind the growing Instagram platform at The Milk Manual. This is where she aims to make lactation education chill and attainable for all. We all like some chill education. If you're a longtime listener of the podcast, you know that I've had the chance to chat with quite a few different CLCs and IBCLCs, so I wanted to make sure that this interview took on a unique and new angle in the realm of breastfeeding. So what we did is we broke down our interview into two main topics today: preparing for lactation during pregnancy, and then navigating breastfeeding and the NICU, which is actually one of Erica's specialties. In the episode, you'll learn more about Erica and her platform, find out what she recommends for breastfeeding prep during pregnancy, learn about the benefits of hand expression during pregnancy, and then we'll get into lactation and the NICU. I'm so excited to tell you about a pregnancy app that you must download to help you ease your journey to motherhood. If you're pregnant, postpartum, or trying to conceive, you might have discovered that this period in time can create a bit of stress and anxiety, even for the most prepared parents. That's why I'm delighted to tell you about Expectful. Expectful is the mental health app for before, during, and after pregnancy. Seriously, this app has so much for your mental health, and it was designed by a team of perinatal experts, holistic wellness practitioners, and moms who have experienced it all. You simply enter your due date or your baby's birth date and receive weekly custom content throughout your pregnancy and postpartum journey. Expectful has a broad selection of over 3,000 meditations with unique collections for cycle tracking, IVF, birth and labor prep, nursing and pumping, postpartum depression, and more. And they also have daily live events and Q&As with lactation consultants, nutritionists, pediatric sleep specialists, pelvic floor therapists, and maternal mental health experts. They even include a hypnobirthing course that has received 5-star reviews from thousands of moms. With Expectful's free 7-day trial, it's a no-brainer to give it a try. You can find Expectful in the Apple App Store or on Google Play. And if you use the code MLN25 off, that's MLN25OFF, either on the app or at expectful.com, you'll get 25% off your annual membership. Go to the App Store or expectful.com today to start your free trial. And now let's get into this week's episode. Hi, Erica. Welcome to the Mommy Labor Nurse podcast. Thanks so much for being here today with me.
Thank you. I'm excited.
Yeah. Can you start by telling our listeners a little bit about yourself and where you're from, what you do, all that good stuff?
So my name's Erica. Obviously, I am an IBCLC, a lactation consultant in Houston, Texas. I've been a lactation consultant for 5 years now, but before that, I worked as a mother-baby nurse for 5 years, and I started my nursing career actually in the operating room, but this was always my passion, so I'm really just very excited to work where I work and do what I do. Yeah, that's pretty much like the professional aspect of who I am.
Yeah, cool. And what about, hey, we can get personal. Have you kids? You got any pets? You got
Yeah.
a, partner, spouse? What's going on at home?
Yeah, I live here. I have my husband, we have a dog. I have 2 children. They are 5 and 6, and I breastfed both of them for like 13 months, both of them,
Nice.
14 months, something like that. Yeah. But they're old now and it's
Yeah.
May, so we're like in the crazy season of school
Oh, yeah.
ending and, I don't
Oh,
know
yeah.
why
I
May
feel
is
it.
so wild.
It is. It's so wild. And I of
Yeah.
course, I decided to schedule a bunch of like just trips and stuff in May as well. And just, I was not thinking when I did
Yes,
that. But
I
yes,
don't know what it is, me neither.
yeah, it's weird. All right. Well, today, guys, obviously, this podcast episode, we're going to be talking about breastfeeding stuff. Most of the people who listen to this podcast are pregnant or they just had their babies. So let's talk about some like prep during pregnancy that you can do. If you know that your goal is to breastfeed, is there really anything that you can do? And we've talked about this some, but is there really anything that you can do during your pregnancy to kind of set you up for success and, prep for breastfeeding after you give birth?
Absolutely, there is. And I love this question because I feel like a lot of us, we think, oh, it's going to be natural, it's going to be easy. We just kind of
Yeah.
go with the flow about it. And while I do think there is an aspect of feeding your baby that you should go with the flow, I also feel like it's so important to like plan. And I think planning can sometimes help with the expectations going forward, especially, just how mentally taxing it can be, how emotionally taxing it can be, and just having even a plan for how you'll overcome hardships. So, with just if you decide, hey, you know what, I want to breastfeed, I feel like the first thing you could do, and this might be like hit or miss, but talk to your OB about it. See what kind of information they can provide you with. A lot of times it's not discussed, in your prenatal visits or anything like that. But I know a lot of people would love to talk more about it. I would take a breastfeeding class if you can. I have one on my site, but also lots of hospitals offer them for free. So if your hospital offers one, I would say take one of those. Definitely reading some books on breastfeeding. And I do have a post on that as well, but there's lots of books that really go down to like the nitty gritty of just how to do it. And it's not even necessarily like how to do it, but it's more like, reasons your supply could be impacted, things that you can like, say like you're in the hospital and you get a lot of fluids, like how to combat those type of things and also still be able to breastfeed. So I think the biggest thing is like taking a class, asking questions. If you have it in your like budget or if it's a feasible thing to do, even reaching out to a lactation consultant and doing a prenatal visit beforehand. But if not, if you aren't able to do those things in a class, reading some books, also getting your breast pump through insurance.
Yeah, that's really
Yeah.
important. And usually you can do that week, I don't know, 30 something around
Yeah.
that time, up towards the
It's in
end,
that final trimester. Yeah.
Yeah, no, those are good tips. And I mean, we preach the same thing, like prep, 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 right?
Hmm.
And I liked what you said about the getting with an IBCLC too. I know not the pediatrician that I'm currently with, but the one I was seeing before, they had lactation like on staff. And so I always
Ooh,
tell
that's
people that
nice.
too, when you're, when you're shopping around for a pediatrician, if they have lactation consultants on staff, like that might be something to look for because then you go to the pediatrician, you can, a lot of times they'll say, oh,
Yes.
do you want to see lactation after our visit? So that's also another thing to kind of like keep in mind while you're pregnant, like in shopping around for a pediatrician.
That's really smart, actually. That's a really good piece of advice.
Yeah. I want you to bust a myth for me though, because I get this question all the time. People are like, what can I do for my nipples? How do I prep my nipples for breastfeeding?
You know what? It's so wild to me that like old wives' tale or whatever
Yeah.
is still going around.
Yeah.
I had never heard of it until I started doing this as a job, where people were like, "Oh, my mother-in-law told me the reason why it hurts so much now is because I didn't prep my nipples beforehand." But yeah, like you said, that's just a huge myth. You don't need to do any type of physical prep for the most part. I will say we'll probably talk about it later, but like prenatal, antenatal hand expression is
Yeah.
different. But you don't technically really need to do any physical roughening up your nipples. Like someone recently told me that their mother-in-law told them to put sandpaper on their nipples. And I was like,
Yep. I've heard
that's
that.
not cool. Like, no, definitely do not do any of those things.
Yeah. And to say too, like when you're nursing, it should not feel like there's sandpaper on your nipples. So why are we putting
Exactly.
sandpaper like feelings on our nipples before we're
Yes,
breastfeeding?
exactly.
Crazy. All right. Well, let's talk about some expectations versus reality. Can you speak a little bit to that? I know that a lot of times I think there's kind of like two trains of thought. So you can either go into breastfeeding like you're going to wing it, you're like,
Hmm.
whatever, it is what it is. Or you go into like breastfeeding with like really, really high expectations, then it goes
Yes.
sideways.
Yes. So I also feel like this is another reason to do read the books, take the classes,
Mhm.
and kind of do your research in the prenatal period because I feel like, and this is just my personal feeling, so like don't quote me or do quote me, but it's not like scientifically proven or anything. But I think a lot of times, first of all, motherhood obviously comes with a lot of heaviness and fat and like in the fact that we have expectations of what we want and what we don't want. And a lot of people have carried this feeling of breastfeeding almost being synonymous with being a good mother or breastfeeding being the sole purpose of motherhood. Like if there was a pie chart, so I feel like some people would give breastfeeding 80% of that pie chart, when in fact it's really not. It is a very big thing and you are doing it all day, every day, but it's not the only
Yes.
aspect of motherhood. So a lot of times when I meet people for the prenatal aspect, I do like to talk to them about what their expectations are. I do think having goals is very healthy. I'm a goals girly. I love having goals, but I also think it's really important to have short term goals and know that you can take a day to day. And if your plan changes, that's okay. Your goals can shift along the way. And we have to kind of open ourselves up for that flexibility, especially with breastfeeding. But yeah, I think, like you said, some people go into it and they're like, it is what it is. And then other people go into it where it's like, I'm going to breastfeed and that's the only option. And I feel like there's definitely a healthy middle where we should be.
Yes.
I'm not saying ever like you give up on breastfeeding or anything like that, but I think it's important for our mental health, especially a lot of people's mental health, to just go in knowing, yes, this will be hard. Here's how I've prepared. Here's my plan B if things aren't working out. Here's my plan C. Here's how I'm going to take care of myself as well. So, a lot of that prep and getting ready for breastfeeding, I feel like, is also just kind of making sure you take care of yourself in that space.
Totally. I love it. And let's touch on the fact that breastfeeding is such a learning curve, too.
It
I mean,
is, yeah.
I know that there is a ton that you can do in terms of prep, but I always use this example that pumping is the kind
Mhm.
of thing that you can learn some things, but like
Mhm.
pumping is the kind of thing that it's so hard to learn anything until you actually have your hands on your pump and you're doing it yourself.
100%. Yes. Yes. Like people will have a pump and be like, can you explain this? Or, like when I used to work in the hospital, they would
Yeah.
bring their pumps and I'm like, well, you don't need to pump just in this moment, but we can go over it, but it's going to be different in the actual moment of using it. Or when people ask how to use it whenever they're pregnant, I'm like, baby, let's just take it one day at a time. Like we are
Yeah.
trying to cross off too many boxes. And I get the eagerness for the pump, but yeah, it is one of those things you do learn over time. What did you ask again? I like get on really long tangents.
Girl,
Little
I'm the same way. Don't even
superpower of
worry
mine.
about it. Don't even worry about it. I always ask that question. I'm like, wait, so what was the original question? They're like, no, it was this. So it's fine. So I spoke to a learning curve and I said that there is such a learning curve when you first
Yes.
start breastfeeding. And I think it's even more evident with pumping, but like there's so much I feel like I learned with my first one right
Hmm.
after, starting breastfeeding, but there was still so much that I learned with my second one for the second
Yes.
time and going through it for a second time and learning like on the way. So I think like again, there's two groups of people. There's the
Hmm.
super planners where you set your expectations super high and you're not anticipating that learning curve. And then you might be the other route where you might deal with that learning curve so well. But I think like if we name this episode like breastfeeding is a learning curve, that should be the name of this episode because that is something
Yeah.
that I think that a lot of people don't recognize until they're in
Hmm.
it,
And
you
I
know?
think it's important to say it too. I
Yeah.
think a learning curve is a better way to put it than just like, oh, breastfeeding's hard. Like, I feel like a
Yes.
learning curve is
Yes.
also giving the positivity to it that can help people, I think, stay focused on their goal. But yeah, it is such a learning curve. And like you said, you learn a lot with your first. You still learn a lot with your second. I have my kids really close in age. And I feel like, as soon as I was done breastfeeding, 6 months later, I had another baby. So it wasn't
Yeah.
like a huge gap in between. But even once my second baby was born, I was like, oh, yeah, like the latch needs to be deeper, just like little
Yep.
things where I was like, oh, yeah. But also with it being a learning curve, I think it's important to talk about that more because of the whole concept of breastfeeding being quote unquote natural. And truthfully, I don't really like when people say breastfeeding is natural, only because, like, yes, I know it's natural. Walking's natural, breathing's natural. I think a lot of times when other people are hearing it, they get that expectation, well, natural equals easy, when
Yes.
natural can still be a learning curve. And also, this is like just again me, just not a scientific fact, but I also feel like as we advance as a society, especially technologically, we do stray a little bit less away from our natural aspects.
Mhm.
So I think it's okay for us to like not feel that things are natural anymore because there's so much about our lives that aren't natural. So it's like if you go to breastfeed and you hold your baby and you're like, this doesn't feel natural to me, a lot of people's gut feeling is guilt. Like, oh, I felt guilty that this didn't feel natural. But it's like, girl, like we have communications via Zoom. Like that's not
Yeah.
natural. Like there's so many things that we have done in our lives nowadays that like our predecessors or whatever have not done. So it's like, I don't think it's bad to feel unnatural sometimes. It's just, it's different and we haven't learned it and it's a learning curve and you'll get there. Like eventually it'll feel good. It might not ever feel natural, but it'll feel the way it should feel for you. You know what I mean?
Yeah, I totally get it. No, that's a
Yeah.
great way to put it. We don't live in a very natural world, I feel like,
We
much
don't, and it's
anymore.
okay. Like it's
It's
okay.
okay.
Exactly. I feel like sometimes like it sounds bad, but it's like, yeah, I'm on Zoom. Like, there's so many little aspects. Like I'm on a cell phone all day. Like there's so many little aspects of my life that I'm like, this is so probably like if somebody got on a time machine, they'd be like, what? Like, and it's to our benefit, obviously, and it's
Right.
like to our demise that we aren't, but it is what it is. Like we're
I hear you.
thriving.
I hear
We
you.
out
I hear
we're
you.
out here living. Yeah.
So true. All right, the sound of that baby crying means it's time for this week's segment of Birth It Up Babies. All right, this one says, well, I did it. Bought your Birth It Up Natural series, listened to it while finishing off the nursery of baby number 4. Cool. My husband listened to his section the weekend before my scheduled induction due to health concerns. I got my first unmedicated delivery and it was incredible. Oh, that's so cool. 100% because I had a nurse and a husband who said I was capable and could do it. That is great to hear because, gosh, like your nurse and your support people, I'll say like your support people are so like vital to your experience. And that is one thing that I constantly am doing in my patient's room is I'm trying to keep the room full of positive vibes because and there is nothing worse than a nurse taking care of you saying like, oh, you should just get an epidural. Or if you want an epidural, like you don't need it. Just like, I just don't like negative Nancy's. Sorry. All right. Anyways, going back to this Birth It Up baby, I was able to relax through all the contractions and was even laughing with my husband until transition hit. He felt so empowered and knew exactly how to support me. Baby was out before I could push or the doctor get there. Whoa. Well, that's not uncommon for a 4th baby, but I love it. All right, everyone, I want to take a moment and talk a little more about our sponsor on today's episode. They are called Expectful. Expectful is the mental health app for motherhood. Whether you are trying to conceive, currently pregnant, you're preparing for labor, already have an infant, or even older kids. Expectful also has content just for birthing people who have experienced a miscarriage or child loss. They really do offer something for everyone. Here at MLN, we know that pregnancy and birth come with a lot of what ifs. And when mamas aren't sure what to expect, they often enter labor and delivery feeling anxious and unsure. But that doesn't have to be your story. From videos to live event classes to wellness services like sleep coaches, nutritionists, fertility coaches, and more, you can use Expectful to find support for wherever you are in your journey to motherhood. And I don't just mean something you get on once or twice and don't use. No, I mean truly anxiety reducing, stress lowering support. Expectful is actually scientifically backed and has been studied in the Journal of Midwifery and Journal of Perinatology. I actually personally used the Expectful app during my last pregnancy with Ryland. I had some really horrible pregnancy insomnia, and honestly, listening to a guided meditation on their app was one of the only things that helped me get back to sleep in the middle of the night. And we all know how critical sleep is for pregnancy. But the one thing I really love about this app is that it provides a non-pharmacological, low-cost solution for reducing prenatal and postpartum stress. Their regular subscription is $69.99 for an entire year, and their HSA and FSA covered if you have it. But we do have a special code for you today that I'm going to give you in just a second. So keep listening. All right. So one last thing, Expectful was actually awarded Best Pregnancy Meditation App by The Bump. And you all know that I love The Bump. And there is a reason why. Expectful has a 4.8 star rating with over 3,000 reviews on the App Store. It's because this app is simply invaluable during pregnancy. With Expectful's free 7-day trial, it's a no-brainer to give it a try. You can find Expectful in the Apple App Store or on Google Play. And if you use the code MLN25 off, either on the app or at expectful.com, you'll get 25% off your annual membership. That takes the price down to just $4.37 a month. Go to the App Store or expectful.com today to start your free trial. All right, well, let's move on to like hand expression. And I know this is a podcast, right? So we can't really
do visuals.
do too many visuals. But I think hand expression is so important to touch on because we like to talk about it. And as a previous postpartum nurse, like to talk about it with our moms right after they deliver, how beneficial it is. But you can learn about hand expression while you're pregnant and actually express some colostrum while you're pregnant too. So let's talk about that.
Yes, so that's kind of going into how we were saying before, you don't need to prep your body beforehand or anything like that. Now, antenatal hand expression, which is hand expression during your pregnancy, is also an option to kind of harvest colostrum. Whenever you do this, it's usually recommended to wait until about 37 weeks on because it can, for some people, cause uterine. I don't think contractions. Okay, I was like, I think it's contractions. Well, uterine, it causes
irritability and contractions.
Smaller contractions, which can put you at risk for going into labor. So a lot of times if you plan to do something like this, it's really worth discussing with your OB, discussing with a lactation consultant who can work with you and just kind of monitoring. But I have had some clients who've done it before, which I was very impressed when I got to their house and saw like how much colostrum they had saved. But a lot of these same people, it was their second baby. So, they learned a lot more. And they learned also that with their first, they were at risk for a low milk supply, which you can learn a lot from some of these books, like if you're at risk for a low milk supply or not. But a lot of people, when they realize like, oh yeah, with my first, I had a low milk supply for X, Y, and Z reasons. Now I'm doing hand expression so I can get my milk kind of flowing a little faster, a little sooner.
I had a friend who just did that. She just had her third baby and she brought it into, because with her first two, she was exclusively pumping, but with her first two, she had the low supply. So she was like, I'm going to go ahead and start harvesting. So, we don't have to, she was like, if we have to give formula, that's okay. But like, I have my milk, so I'm going to bring it into the hospital in a little freezer.
Yeah.
She was fine.
Yeah. Good for her. That's really nice.
Yeah.
To be prepared like that.
I know. So I love talking to moms about hand expression during pregnancy for that reason. But I know we don't have visuals, but do you think we could talk about it a little bit? Like, how do we even do it?
Yeah. So, okay, I have a video on my Instagram too of how to do it. And then there's a really great video online. I can't think of the website, but anyways, I have one on my Instagram. So a lot of people think when they hand express that they're supposed to take their thumb and their pointer finger and pinch their nipple, but
Mhm.
you don't want to do that. You actually start with your hands on your breast, like as close to your chest as, not as close to your chest as possible, but like right in the middle. You want to grab onto your breast. Your fingers aren't on your areola, they're not on the nipples, they're like right on the outside of it. And then it's just a gentle compression, like almost like you're squeezing a stress ball. And a lot of people will try and slide their fingers down towards their nipple. And that's like one method, but really it's just using your hand, pushing back, and then just compressing.
Yeah.
And it is, again, a learning curve. It'll take some practice. I can even say for me, having worked in mother baby for so long and then being a lactation coach and having my own children, it was still on my own body more difficult for me to do than it is for me to do on someone else's body. So
Totally.
it's a learning curve, but once you get the flow of it, you really got it.
Yeah, no,
Yeah.
totally. I found the same thing. It's easier to do on other people. And when I was
Yes, it
actually
is.
doing it on myself, I'm like, I feel like I'm
Yeah.
not doing this
It's
right.
like your arms also are have to be like awkwardly like
Yep.
moved in a way that it's just like my arms never been this way before. So why,
They're like this.
Yeah, like again,
Yeah.
it feels unnatural, but it's just like I've just never done it. So it just
Yeah.
feels weird. But
Yeah.
once you
Yeah.
get the flow of it, it definitely like I love teaching hand expression also. And I love people's faces when they do it by themselves for the first time and they're like, oh my gosh, like it's so exciting to watch people learn a new skill by themselves and like really taking what I've said and like do it on their
Yep.
own. So yeah, I love to teach hand expression. I think it's a good little party trick. It's a good little thing to have in your back pocket because you just
Yeah.
never know when you're going to need it. Like
Yeah.
you could be really engorged at a concert or something and you might have to go to the
Yep.
bathroom and like get it. It's just a really good little skill to have as far as like just in case like I need to get this milk out.
No,
Yeah.
good point. And I remember when I was still nursing my older one. He was older, so I wasn't engorged or anything. But I live in North Carolina, so there we have hurricanes here like every
Hmm.
year. And our power went out. And like that was one thing that I talked about in my story of like, oh, hand expression is a really good thing to learn just in
Yes.
case your power goes out and
Yes.
you're pumping and you need to, like that pump, you can't plug the pump in.
Exactly. You just never know. Like it's just
Yeah.
a good little reliable thing to have in your pocket at
Yep.
any situation, just in case.
Yep. Yep. No, totally. I know everybody's thinking this during pregnancy. How long do you even do it for first? Like, are you even going to expect any milk the first time? Like, kind of what to expect.
With pregnancy, not a lot. So,
Yeah.
you're not going to, those bottles full of milk, we're not going to see that. With colostrum, it's going to be way different. I'm not 100% sure because I know every facility is different, but here in all the places that I've worked, if you are harvesting colostrum, it's like in syringes, like,
Yeah.
maybe even the first time you do it, getting like 2 milliliters. Like it's truly not a lot, but a little goes a long way with colostrum. And over time, it does start to build up.
Yeah. Yeah. No, that's a good tip. So, with hand expression, I know that one thing that I want to talk about is like how to bring it to the hospital. I know I talked about my friend who was bringing it in her little cooler pack. But if you're expressing it during pregnancy, I think an important thing for moms to know, it depends on where you are in your
Yeah.
pregnancy, but breast milk, let's like go over some storage guidelines, right? Like breast milk is only good in the fridge for however long and only good in the freezer for however long. So if you're harvesting it, it is important to put it in the freezer because you don't know when you're going to deliver.
Yep.
Yeah.
Yeah, I would definitely go straight to the freezer,
Yeah. Yeah.
especially, yeah, because you just never know when you're gonna need it. And
Yeah.
like you said, right now, the CDC guidelines, it's good in the fridge. I want to say the minimum is 4 days right now,
Yeah.
or the average is about 4 days right now. So, yeah, if you're not going to deliver for another 3 weeks, then go ahead and just put it in the
You
freezer.
stick it in the freezer. Yeah.
Yep.
And then most of my moms come in and they just have a cooler bag with them. Is that kind of
Mhm.
the what you've seen, or
Yep.
have you seen where they have to get any sort of permission or anything?
So listen, I haven't, but I'm also kind of like, it's your milk to give. You have to give it. Like it's
Right.
not a drug. So it's
Right.
like, if you're gonna give your baby 2 milliliters of colostrum, obviously you can communicate that. But at the same
Yeah.
time, truthfully, I just wouldn't even ask. I would just bring it in.
Yeah.
But that's just
Agree.
me.
Yeah, no, agreed, agreed. All right, well, let's talk about the NICU a little bit, because
Yeah.
when we talk about bringing milk in, a lot of these NICU moms are very familiar with this and pumping and all of that. So I love that you actually have an ebook all about lactation and the NICU because that can be very, very challenging, right? And a lot of times when you have a NICU baby, you're not anticipating that you're going to have a NICU baby, right? So can
Hmm.
we talk about maybe a few tips in terms of breastfeeding, pumping as it relates to NICU moms?
For sure. So some of the biggest things, like you said, it's just you don't plan for it.
Yeah.
So I always just feel like this is one of those times to give yourself the most grace that you can because you didn't plan for it. And it is still, I feel like from the moment on, like it's going to be hard to plan for anything that's happening. So you kind of have to, again, take it day by day. And it involves a lot of communication with hospital staff and with nurses. And hopefully, if you have lactation consultants at your facility, so that's the number one thing is like being patient with yourself, remembering like, because I think a lot of times people start to get worried that that expectation of motherhood that we have is all of a sudden gone and things are going to change. And your expectations, the vision that you had isn't gone, but it is going to change its path a little bit. And then another big thing that happens at this point is pumping. And this is another reason why I think it's important to get your pump as soon as you possibly can, even if you don't think you're going to use it. Like, even if
Yeah.
you end up not needing it, it's still just good to go ahead and have on hand just in case. Because I've been in a lot of situations where people, they were like, well, I'm going to exclusively breastfeed. So I didn't buy a pump. And then their baby goes to the NICU and they get discharged before their baby gets discharged, which is also really difficult on you emotionally and the stress of it all. And then they go home and then they have to call their insurance and start dealing with that
It's a
added stress
process.
of getting a pump.
Yeah.
Meanwhile, they're not, you know what I mean? It's just a lot. So, whenever a baby is in the NICU, it's going to be a lot of grace, communication, lots of pumping, lots of skin to skin if you can, lots
Yeah.
of taking pictures of your baby, like just having as much of your baby as you can when you can't be with them.
Yeah, no, that's a good tip. And even for moms who are going back to work, like, hey,
Mhm.
take lots of videos of your baby. I'm sure,
Mhm.
that's most people don't have
I
any
know.
problem with that. But
That's an easier
yeah,
one.
lots of videos and pictures to take with you, even like something, of their clothing or something with their smell when you're pumping can help. But yeah,
Mhm.
because it's such a different experience pumping, right? And you've probably seen this more than I have as a postpartum nurse, but like it's such a different experience pumping like right next to your baby, like in the same location as your baby versus like being at home. So like
Yes.
as much things, to do with baby as we can bring along with us, the better.
Uh-huh. Yeah, and some facilities even will allow you to pump at the baby's bedside. So
Nice.
if
Yeah.
that's an option, I always recommend doing that. Obviously, if you can't do it every day, that makes
Yeah.
sense, but trying it
Yeah.
at least once or so.
Yeah. Yeah. No, that's a very good tip. Well, this was a wonderful episode. Thank you so much for coming on
Yeah.
with me.
Thank you for
Can
having
you
me.
tell can you tell our listeners where they can connect with you and get more from you? Because I know everybody's just, obsessed with you now. It's who's this IBCLC? We want to go check out her
Yeah.
ebook.
Yeah. Come check me out. So on all social media platforms, it's at the Milk Manual on Instagram, TikTok, Pinterest. I don't have a Facebook. My website is at the Milk Manual. And on my website, I do have that NICU guide that helps
Cool.
navigate back to the NICU. Yeah, it's like a little over $10, so it's not
Cool.
very pricey. I also have a back to work guide that I just launched a week or so ago. There's a breastfeeding class, like a beginner breastfeeding class, specifically if you plan to birth in a hospital, because I took my experience of being, hospital based IBCLC and a nurse to kind of let you know, like, oh, if you had a C-section, like this can help in these.
Yeah.
So that is that course. Yeah. And lots of good things on there. If you ever want to be an IBCLC, there's also more information about how to become one there. But
Oh,
yeah, that's where you can reach me. I'll be there all the
love it.
time.
Love it. I know. I
Yeah.
know how it is. I'm like, I'm on
Yeah,
Instagram every day. This is this is where I'm at. If
exactly.
you want to
Here
reach
I
me.
am, y'all.
I know. Cool. All right. Well, we'll leave all of those links in the show notes page for people to check out. Thank you so much for joining me today.
Thank you for having me.
All All right, guys, that wraps up this week's episode. Thank you so much for tuning in and letting me be a part of your motherhood journey. It is truly an honor. If you like what you heard, don't forget to hit that subscribe button so you never miss an episode. And I love hearing what you guys think of the podcast. So if you're liking what you hear or you have a suggestion, I'd be so grateful if you'd go ahead and leave me a review wherever you're listening to help more mamas just like you find the show. What do you think? Are you starting to feel a little more confident about your pregnancy and birth? Well, if you want more, be sure to head on over to mommylabornurse.com/podcast for today's show notes and a library of episodes so you can keep getting educated before your upcoming birth. And while you're over there, be sure to check out the blog and learn about our online birth classes. Find it all and more over at mommylabornurse.com/podcast. See you next week, same time, same place.